Hi, everybody. It's Dr. Coughlin. I am back in beautiful Massachusetts. It is spring here and absolutely glorious. I have been thinking more and more about this issue of insight and what Davanloo referred to as driving home the insights, particularly between the corners of both triangles. So I'm going to talk with you about that again today. I had 3 supervisions last week, all with new trainees who had trained, with other folks in ISTDP, and yet who were missing a lot of the basics. I think there's a certain misunderstanding that ISTDP is just about getting a breakthrough of feeling almost at any cost. And this is really making the mistake. It's going way back. I mean, Freud figured out 100 years ago that cathartic release of emotion led to temporary relief at best and no lasting change. So in order for the patient to really make changes, their ego, their conscious mind, has to be able to tolerate and come to terms with all of their feelings and the accompanying anxiety and guilt. So it really is about making those unconscious feelings and impulses conscious and helping the patient see how all of the ways they have defended against their feelings have actually created and perpetuated their symptoms. So these are the insights and the links that you have to, again, drive home in order to help the patient develop lasting change. And this is actually a repetitive and circular process. So it is not enough for you, the therapist, to see that they have feelings they're anxious about and defending against. So I often see as soon as the therapist sees it, they start to try to manage the situation and say, well, if you don't cry and go to helplessness, how do you feel this anger? And they will just press for the anger and sometimes sort of drag the person through a portrait of anger, hoping that that is going to change them. But, what Davanloo wrote about is the profound inability that many patients, particularly patients with depression, panic disorder, and somatic disorders, all the chronic pain and unexplained medical symptoms, these patients suffer, he said, from a profound inability to distinguish between their feelings and impulses and the defenses against them. They mistake one for the other. So like a patient I had who we were looking at anger and she kept crying. And I said, you're telling me you're angry, but you're crying. You're washing it away with tears. And she said, but this is how I do anger. So she was fusing her feeling with her defense, which again is very common in depressives. So it's not enough for me to barrel through that, but to show her over and over again. So I say, so how is this anger? How is crying anger? And she said, well, if I have a good crying jag, I usually feel better. So again, this is just her discharging the anxiety around the anger, and it does lead to temporary relief. So, give the devil his due. I said, okay, so you feel some temporary relief, but then what happens? So we have to go over and over in this until she sees that she is extremely anxious about her anger, and she does all kinds of things, either internalizing, crying, going to helplessness, weepiness, depression, or she could also flip and then act out and discharge, spending money, driving motorcycles, things like this. So I saw this in one of the supervisions I had last week where the patient, again, had a mistaken idea, right? She mistook her defense of acting out for the feeling of anger. And so when the therapist was pressing her to experience anger, she said, I don't want to do that. that gets me in big trouble. So she thought her feelings were the problem. She didn't realize acting out is a defense against her feelings, and it's the defense that's the problem. And the therapist didn't help her to see that. She just kept pushing. Now, what's going to happen if you don't distinguish between a feeling of anger and the defense of acting out and discharge? People are going to get worse, right? She's going to think that anger is screaming, yelling, and throwing things. So this is the other huge problem with this, trying to go too fast and just getting this breakthrough, is that people get worse. They're going to get more depressed, or they're going to start acting out more because you haven't helped them distinguish between their feeling and the defense against it and how that causes their problem. So that's what Davanloo meant by driving home this insight. You have to help them see it. I had another case of a woman who got horrendous headaches, and she had been hospitalized for these since the age of 8. And now she was like 36, I think, when she first came to see me. And so she would instantly repress not just her anger, but rageful impulses. In fact, as we ended up finding out, impulses to smash other people's heads. But she would end up with this headache that she said it's like smashing on the sides. And she said it's as if icicles could pierce my eyes. Okay. Now, of course, later we found out whose eyes she actually wanted to pierce. But what would happen was instantly, when she was angry, she would begin to get these symptoms. So I had to show her. We were going for a particular incident. She had gone home to see her family. Her father and brothers were sitting across the table from her. And this is when the headache started. So I said, well, what was happening at that time? And she described what was going on at the dinner table. And then I asked her, how was she feeling and toward them? And she said, oh, if I just could have smashed their heads together. And she said, and if icicles could pierce their eyes. And then she went, oh, like instantly, oh. And I said, do you see what's happening here? I said, in a split second, you want to smash their heads, but your head is hurting. So to us, it's crystal clear. She still didn't get it. I had to go over that like 3 times explicitly, talking about the one-to-one relationship between the impulses toward the other that she was suppressing and her very symptoms. So it was after the 3rd time that she kind of looked up and said, oh, yeah, heads, eyes, oh yeah, right? So again, this is a laborious process in many cases, right? You have to go over and over at these links between the defenses against the feelings and the symptoms, and how that happens in different situations on the triangle of person. So I really want to urge you not to shortchange this process. I mean, this is a basic tenet of psychoanalytic theory, is always deal with defense before feeling. And a lot of people are trying to just run over, or they take it on themselves to block the defense and go for the feeling, thinking that the defense will just go away. Well, that very rarely happens, right? So drive home those insights. Really take your time in the beginning to go slowly over these, especially, again, that link between defenses and symptoms. And then your treatments will go much faster in the end. Because in all 3 of these cases last week, the therapist had been seeing this patient for a year. And the patient still did not know how to distinguish the corners of the triangle. And they continued to mistake their defenses for their feelings. Therefore, the patient and therapist were working at cross purposes. The therapist was saying, let's go for these feelings. The patient was saying, feelings get me in trouble. I don't want to do that. So I hope this is making this point clear. And I also urge you, if you have not done so, to read Davanloo's work. I see many people who are calling themselves ISTDP therapists that have never read the original sources. So I would really start with the edited volumes he did in the late 70s, and then also Unlocking the Unconscious, especially in 1990. And then he wrote another one in 2000. So go back and read those original sources, and you're going to see how much emphasis he puts on insight and driving home these links. So I hope this is helpful to you. And, write me with any comments or questions or other things that you're struggling with to learn this complex but effective treatment. Thanks. Bye-bye.